Hello everyone and welcome back to Youthful Medicine. I am Dr. Tahir, board certified rheumatologist and obesity specialist. Today I'm going to talk to you about a question I get a lot from my patients who are dealing with obesity and metabolic syndrome. Why are my insulin levels so high? Well, if you haven't checked your insulin levels, please ask your doctors to check one because you'll get a useful information out of it. So let's break it down what's going on here in a way that's easy to understand. First off, insulin is a hormone that acts like a key, unlocking our cells so that the sugar or the glucose from the food can enter into the cells and used for energy. But in people with obesity or metabolic syndrome, the cells don't respond as well to insulin. This is called insulin resistance. So imagine insulin as a key, but the lock is jammed, the door won't open easily, and the body has to make more keys, or in this case, more insulin to get sugar into the cells to be used for energy. Now, think about all that sugar converting into extra belly fat or visceral fat. So the extra belly fat, especially that stubborn fat around our waist, it isn't just sitting there. It is actually active and can release substances that interfere with insulin. These substances make it even harder for insulin to do its job, which means the body has to produce even more insulin to keep up. So now let's talk a little bit about what is also happening because of this insulin resistance and the relationship with insulin and inflammation. There is also a hidden factor, which is the low-grade inflammation in our bodies, which is like a small fire that's always burning in the body when someone has obesity or metabolic syndrome. It's not something you feel directly, but it makes insulin work even less effectively. So once again, the body ramps up insulin production to overcome this resistance. And here's another piece of puzzle, another hormone called leptin. Leptin helps control hunger and how fat is stored. But in obesity, many people develop resistance to leptin too, which can lead to increased hunger and more fat storage, making the insulin resistance issue even worse. Now you understand that insulin resistance and leptin resistance lead to more obesity. All of these factors together, insulin resistance, visceral fat or belly fat, low levels of chronic inflammation, and leptin resistance, they create a cycle. As the body struggles to keep the blood sugar normal, it produces more and more insulin. And over time, this can wear down the pancreas, the organ that makes insulin. This often leads to higher blood sugar levels and eventually type 2 diabetes. Now, in summary, high insulin levels in people with obesity and metabolic syndrome happens because the body is not responding well to insulin. To compensate, it produces more insulin. And while this strategy works for a while, it's not sustainable in the long run. So it is in our best interest to eat low glycemic foods that do not trigger too much insulin release. And for this reason, I ask my patients to consider using Mediterranean diet, which is low in glycemic load. Thank you for tuning in for this video. And if you found this video useful, please hit the like button, subscribe to Youthful Medicine, and let me know your thoughts in the comments. I will see you next time with more on management of obesity, metabolic syndrome, and living your healthiest life.